My name is Professor Paul Harnett, and I'm the Director of the Crown Princess Mary Cancer Centre, Westmead. And I've been in oncology practice for 25 years. And I guess I've been asked to speak about MDTs, and the best way I can show that I think they really do make a difference is the fact that despite 25 years of experience, I still take all of the new cases that I see for discussion at one of these meetings. Over the years, we've built up a number of these teams focused on particular cancers. And around the table, you'll have the surgeons and medical oncologists and radiation oncologists and pathologists who are passionate about that particular type of cancer. So they like to read about it and think about it and study it and treat it. And you can just see the energy that that brings to the clinical problem, and the sort of environment in which you operate is so much better. And even with 25 years of experience, when I present the cases, I often have in my mind the way we'll tackle it, but as a result of the discussion, there can be a little slight difference in the spin or a slight different approach to it, which can alter the ultimate way we tackle the problem. Reviewing the pathology is really important as well, because tumour pathology is very complicated and advances quite fast. And expert pathology is required rather than general pathology. And again, very often we'll review the pathology at the meeting and find out that the stage is just subtly different, which can have quite big implications for the way one treats the patient. Another important part of the thing is the team building. It's not just a meeting, because patients don't actually get treated in the meeting. It's the cooperative approach and recognising how many different ways there are to skin the same cat that brings great value. And after the meetings, we'll often have phone calls about patients saying, "I've just seen Mrs. So-and-so. Do you think we could do this differently or that differently?" And it ends up with being a continuous process of care rather than just an isolated discussion. So I'm quite happy to endorse MDTs where you have them as being probably the optimal way to be treated. And if it was me, I would want my case discussed at an MDT meeting. Having said all of that, how do you find them? And I'm really delighted to see that the Cancer Institute has established the Can Refer website. We use it here at the Crown Princess Mary Cancer Centre in a reverse sense. Often we have patients from the country that we've decided need chemotherapy, for example, and we'll look up the Can Refer website to see where can the patients access chemotherapy closer to home. GPs can do the same thing. They might ask the question, where can I find a group of people who are really interested in treating lung cancer or bowel cancer? Can Refer is the place to find that out. So I thoroughly endorse the Can Refer website as an important tool in managing your cancer patients.